War is the nation's largest veterans group. Obama defended his escalation of the Afghanistan war, which he called, quote, a war of necessity.
As I said when I announced this strategy, there will be more difficult days ahead. The insurgency in Afghanistan didn't just happen overnight, and we won't defeat it overnight. This will not be quick nor easy. But we must never forget, this is not a war of choice. This is a war of necessity. Those who attacked America on 9/11 are plotting to do so again. If left unchecked, the Taliban insurgency will mean an even larger safe haven from which al-Qaeda would plot to kill more Americans. So this is not only a war worth fighting, this is fundamental to the defense of our people.
While President Obama defended his escalation of the war in Afghanistan, in Britain, America's closest U.S. ally, anti-war sentiment is growing. This week, the number of British troops killed in Afghanistan since 2001 surpassed 200. Yesterday, in central London, protesters read the names of the 200 British soldiers as well as the names of 200 Afghan citizens killed in the war. The demonstration in Whitehall was led by former British MP Tony Benn, currently president of the Stop the War Coalition. Tony Benn joins us now from London, a former cabinet minister and the longest-serving MP in the history of the British Labour Party, served for more than half a century. Tony Benn, welcome back to Democracy Now! Talk about the reading of the names yesterday in London.
Well, it was a solemn occasion, and the names were read. But you see, I think you have to understand the history of this. Britain invaded Afghanistan in 1839, captured Kabul, and was defeated the following year, and 15,000 British troops were killed in the retreat. Britain invaded Afghanistan in 1879. Britain was in Afghanistan in 1919. The Russians were in Afghanistan. I led a delegation to the Russian ambassador in London to protest at that. The United States government, President Bush, the first one, funded Osama bin Laden to fight the Russians, to get them out of Afghanistan. And the situation we're in now is very straightforward. The United States and NATO, 40 countries with 64,000 troops, in 8 years have been unable to defeat the Taliban. And this is a Vietnam War for America and for the rest of the, well, for the people involved, soldiers and civilians on both sides. It's an absolute tragedy.
And Obama defended the war yesterday, calling it a war of necessity. Your response to that?
Well, I think you just have to ask yourself the question, is it a war on terror or is it a war on Afghanistan? It's a war on Afghanistan, and to call it a war on terror just entitles you to do what you like. And I don't think it's going to succeed. The other thing I have in mind is very simple. A few years ago, London was bombed by terrorists, and how did it end? From Northern Ireland, how did it end? It ended when we talked to Gerry Adams, who was the IRA leader in prison. Nelson Mandela was denounced as a terrorist by Mrs. Thatcher, and peace came in South Africa when the South African government talked to Mandela, and he came out and became president. I mean, history tells you, and Churchill put it very clearly, jaw talking is better than war, and there will have to be negotiations with al-Qaeda and Taliban to secure the end of this conflict. Of that I have no doubt whatsoever.
Well, Tony Benn, we also wanted to talk to you about the issue of health care. Here in the United States, several congressional Democrats rallied around a public health care option on Monday, one day after the Obama administration suggested it was prepared to abandon the proposal to attract bipartisan support. Senator John Rockefeller of West Virginia called the public option a must, while House Majority Leader Nancy Pelosi vowed to ensure the public option stays in the final House bill. Congressmember Anthony Weiner of New York said President Obama risks losing around 100 Democratic votes if the public option is dropped.
The Obama administration's dwindling support for the public option follows weeks of intensive media campaigning from Republicans and right-wing pundits. Part of that campaign has been to denigrate the single-payer systems of foreign countries. In Britain, the U.S. debate over health care is being closely watched, and now the political and medical establishment in Britain have launched a spirited defense of the National Health Service in response to attacks on the system by conservative commentators in the United States. Tony Benn, you're a former cabinet minister, longest-serving MP in the history of the British Labour Party. Explain your system in Britain and what the battle looks like to you across the Atlantic in the United States.
Well, I mean, for me, and I know America, I'm married to an American, I've known America for 70 years, it's amazing. I think most people in Britain just regard it as being uncivilized for a great rich country to ignore the health of 47 million people. And I don't say that as an insult, but we just don't understand it. It was set up in Britain in 1948, 61 years ago, and I have with me the statement made by the government at the time. Your new National Health Service begins on the 5th of July. How do you get it? It will provide you with all medical, dental and nursing care. Everyone, rich or poor, man, woman or child, can use it or any part of it. There are no charges except for a few special items. There are no insurance qualifications, but it is not a charity. You are paying for it as taxpayers, and it will relieve your money worries in time of illness. And I mean, my family has benefited enormously. I had an operation a few days ago in London. I've got a pacemaker put in under the health service. My wife died of cancer, and for 4 years she had the most brilliant health care. And I suppose one way of looking at it is this. There's a lot of unemployment in the United States, as there is in Britain, and one way of creating jobs would be to build hospitals, recruit nurses, train doctors, and then meet the health needs of the country as well. I just don't understand what's being said. Well, I do understand because I know the people who are saying it, but it's absolutely no relation to the health service in Britain or the needs of the United States.
Well, Tony Benn, I wanted to get your response to the comments of British Member of European Parliament Dan Hannan. He was interviewed on several news networks earlier this year criticizing the British healthcare system. This is what he had to say on Fox News. He was interviewed by anchor Sean Hannity.
Can you explain with some specificity why you are giving such a dire warning to the people of the United States?
Because you're our friends, and if you see a friend about to make a terrible mistake, you try and warn him. And we've lived through this mistake. We've lived through this mistake for 60 years now. It began with the best of intentions. It began because people thought it was wrong for those who weren't well off and couldn't afford the best healthcare to be treated differently, and everyone felt, well, it's kind of a nice togetherness, kind of solidarity thing if we all take part in this experiment. But the reality is it hasn't worked. It has made people iller. We spend a lot of money and we get very bad results. You look at survival rates for cancer or heart disease, we are well down on